Remember, you got to. Okay, cool, cool. Yeah, remember, if you have a question, just unmute yourself and ask because I can't see chat because I'm going to full screen. Okay. All right. I am going to go back since yesterday didn't recover, and I'm going to cover a couple of things really quick. Okay. That way, the slides make sense to those who were not able to view the lecture because it didn't record. Um, Real fast, one of the things that I was talking about yesterday was once we take a wound culture or once we take any type of uh, sample, sputum, whatever it is, vaginal or mucus or anything like that, we we send urine, we send it to the lab. The lab goes about a process of trying to decide out what pathogen it has and it's dealing with, right? And I told you that one of the ways is by gram staining, finding out the first way, is it gram positive, like this violet purple, or is it gram negative, like these pink ones, right? So when they do that, they say they have 100 different choices of pathogens it could be. That might narrow the list down to 50. So the next key is finding out, and these are some common gram positive: staph, strep, pneumonia. Some common gram negatives would be E. coli, gonorrhea, and so forth. Now, the next step that we're going to do is we're going to find out with by doing this gram staining, is this microorganism, this pathogen, aerobic, meaning they have to have oxygen to live, right? Because that's what aerobic means. Because when you do aerobics, you're breathing and you're pumping up a whole bunch of oxygen. So are they aerobic or are they anaerobic, meaning that they die in the presence of oxygen, right? Okay. The There are certain uh, pathogens, microorganisms that can live in both. We call those facilitated. All right. And then the next step the laboratory is going to take is a really fast, simple step. Take the organism, put it underneath the microscope, and look and see, does it have an organelle? And that's what this is. And all an organelle is a tiny little structure of cytoplasmic cells. So, bam, that might have taken off another, 5 off the possible list because it doesn't have an organelle, right? So, another way that they can do, as I had mentioned, that the auger, that's the stuff in the bottom of the petri dish. My micro teacher called it the carpet. And sometimes they'll use blood, like sheep blood, goat blood, different things like that. And if a bacteria or a microorganism burst, when they put that on there, that is called this word right here. It hemolyzes. So that will also eliminate possible suspects of what kind of pathogen we're dealing with. So all of these steps that the lab person does is to solve that Scooby-Doo mystery. Who's the villain? You know? And a lot of times what we find out is that it's the bacteria that when we culture something, we find, right? This is what we're going to see. And bacteria are just single cell microorganisms. And what makes them different than other things is they can be independent and live free of an organism. They don't have to have a host like a parasite does. All right? They they have the ability to freestand. This is why bacteria can live on surfaces for quite some time. Okay, we want to make sure that we remember not all bacteria is harmful. Remember, some of our bacteria is beneficial. Some of the bacteria we have is part of our normal flora, right? And even something as scary sounding as E. coli, when it's left in our gastrointestinal tract, it's beneficial, right? So we have normal flora, normal bacteria that helps and aids us. The next step, and I'm going fast just because we covered this, the next step is that the laboratory in their Scooby-Doo mystery is what shape is it? So they can see that by looking underneath the microscope. And this is the laboratory or the medical term that we're going to use when we're referring to shape. It's called morphology, and you'd want to know that. That's something you'd want to write down. And all of these, and of course, this is one of your Survey Monkey questions. What are the shapes? Well, cocci means they're round, bacilli means they're rod, and spirilla means they're shaped like spirals. And here's a perfect example of a gram-positive cocci, and one is a coccus. And a lot of times they like to form grape-like clusters, and they'll bunch together, right? And then when you have a single strand of coccus, my micro teacher said that's when they start partying and make a conga line, that they get in a little line, and these are called streptococci or staphylococci chains because they form like little chains. And that also can lead us and help us determine what bacteria pathogen we're dealing with. And then sometimes the cocci will pair up and they'll bond with another one. And when this happens, these are called diplococci. And this means there's two for di, right? And this is what they look like. They kind of look like little ants, but it's just two separate round cocci that have joined, okay? This picture is, like I said, it's not a morning or it's not a good early morning picture, but what you're witnessing here is called necrorizing fasciitis, and it is caused, as cute as those little purple grape clusters looked, that can cause this. We used to think it was one specific pathogen that caused this. Now we know there are multiple pathogens that can cause this flesh eating, because that's what necrorizing means. See the black area? That means that is dead tissue. It is necrosed. It's not going to come back. Okay. And so this bacteria actually eats away and uh, takes the flesh from the patient. And a lot of times, if this is not caught soon enough, it can be the death of someone. So we move from coccus or coccilli or cocci to bacilli. And the singular form of that is bacillus. Those are the little rod-shaped ones. Okay? Now, here's what I want you to remember when you think of a bacilli. I want you to write the word, and then around it, I want you to put like a spiky little barrier, like it had um, a protective spikes all around the word, because that's how I want you to remember bacilli. A lot of times, your bacilli can produce spores, and that spore is one of the reasons that, when we wipe something down with bleach or we wipe something down with calvicide or something that should kill 99%, that 1% that's still living, it's these guys right here, the spores. These spores make things darn near impossible to kill the bacilli. And we know that one of the few ways that we can is either by extreme heat and pressure. Okay. Um, and then there's also another form of bacilli, we call them vibros. And one of the reasons I bring this up is because a very common one of those is cholera. And we know cholera kills thousands upon thousands of people every year around the world and third world nations and stuff because they do not have clean drinking water. And cholera goes in and just wrecks the GI, causes just nonstop watery stools and vomiting until your body's so dehydrated that you go into shock. It's a horrible thing, and it's from dirty drinking water. Okay, so remember, make a little spore all around your bacilli. And this is a classic example. Do you see the little rod? It looks just like a little dash. This is a gram positive bacilli. And then lastly, the shape we have is spirilla. The singular form for that would be spirillum, or sometimes you'll hear somebody say it's spirillichet, but I've always just heard spirillum. They're little corkscrew. They look like little ramen squirrely noodles. These guys are not very friendly. I'll give you an example. TB, leprosy. So these guys are really usually very tough to treat and take a very long treatment process. Okay. And this is what they look like. See how I told you they're kind of squiggly? And when we see them, we're always like, ruh-roh, because that's usually that's not something we want to see because they are so difficult to treat. And then we move to viruses. And viruses are smaller than we can visualize with the naked eye. So we can't even see them with a regular microscope. They take specific, special kinds of microscopes, electron microscopes, and until maybe, I don't know, 70, 80, 90 years ago, I don't know exactly, but it hasn't been that long. We didn't have that capability. And it might be a little longer than that, but I don't think so. But somebody can fact check me on that. But we didn't know they existed. And so we labeled and mislabeled a lot of diseases either as something that was bacterial when it was actually something viral. All right, because viruses are 100 times smaller than a bacterial cell. All right, and when you think about that, that's just like, whoa, because we know bacteria, they're small, but virus is even smaller than that. A virus, this was one of your SurveyMonkey questions. What are the structures of a virus? The structures of a virus has three parts. They have a special center, a nucleic acid core, and this is where their DNA or RNA live. Okay? This is their genetic coding. This is how the virus replicates and makes more and more and more of itself once it's in your body. The virus also has something called a protein coat or a capsid. So it's got like a little capsule that protects it and keeps it from being harmed. And then you even have some viruses that have a lipid, which is fat, membrane. and we call that the envelope. And if they have that, they're even harder to treat and harder to get over at times because of they're tougher on the immune system. Now, the ones that do not have an envelope, we call those naked viruses. So because they're missing their little envelope. This is the video that I posted yesterday. How many of y'all actually watched it? Everybody should be saying, me, I did, I watched it, because it was a darn, yeah, it was a darn good video, because it really shows you, and it also shows you how far that sneeze spreads. That's why they say this whole 6 foot apart, and everybody who's taken micro or virology or anything like that, they're like, 6 feet? Sneezes can spread like 15, 30 feet. But you got to do what you got to do, right? But that video, if you haven't watched it, please make sure you do. So now we're moving on where we left off yesterday. Viruses are very complex. And like I said yesterday, a lot of times we want to think of them as alive, like thinking, because they are constantly adapting. This is why we're having the issue with COVID. COVID has changed its strain 30 something times since January. And that's what viruses do. And that's why every year you get a different flu vaccine. Viruses constantly are mutating and changing. And because of this, it allows them to survive. Okay? Now, here's the thing we need to know about viruses and how that they attach into the body. One second. This is showing you SARS-CoV-2, or COVID-19, right? Well, a virus cannot get into a human cell unless that cell has a receptor. So think about viruses, all viruses, like a key. And they have to find the right cell with the right lock. And once they do, because they have the key, the cell's like, oh, hey, welcome home. Come on in. So glad to see you. And they actually send a welcoming party up, gather the virus, bring it in, and attach it to it. Like, oh, where you been all of our life? We've missed you so much. And allow the virus to start replicating. Because that virus had the key to the front door. Now, why do some people get sick with viruses and others don't? Those people may not have enough locks to match this virus's key. Does that make sense? And so they have maybe a resistance or a specific immunity, or they were lucky enough that something in their immune system, one of their army white blood cells that travel around the body, caught it and disposed of it before it had a chance to find its lock. All right? So does everybody understand that? What I mean by a lock and a key? That a virus can't just get in unless it has the appropriate. But like I said, because they are so smart, and the non-thinking kind of, it's still very hard for me not to think of them as thinking organism because of how much and how adaptive that they can become so quickly. So it's like it's really scary. So they've got to be able to find that area, and because of their adaptation, they make keys really quick. Oh, I can't get into this lock. Can I do? How do I fix that? You see what I'm saying? Okay. Next thing we're going to talk about is protozoa. Super simple. Got lots of words over here. Do you need to know all of this? If it's your cup of tea, go ahead. There are more than 50,000 type of protozoa. You need to know one thing. Protozoa require water to live. And then now I'm going to tell you this, and it's going to ruin everything. You can find protozoa in a speck of dirt. You're like, well, Miss Scalv, how the heck are you going to find it if it has to have water? Because there's microscopic. There's water everywhere. And it's not just the sea and rivers and lakes, and it can be dried, decaying things. It could be soil. It could be the places you would never expect because you think protozoa, water, right? So your mind automatically goes to bodies of water, but it can be in other places, right? Because as long as it has a tiny, tiny, tiny microscopic amount of water, it can survive. All right. Malaria is one of the most common protozoa type of born illnesses that we can think of from that, and it's bad because we know that how it's spread is through mosquito bites, and from person to person, right? And it can cause a wide range of symptoms, and if left untreated, it can cause death. Another one that's really bad would be dysentery, and that's when you get what do they call it? When we went to Honduras, Montezuma's Revenge. They said, don't drink, make sure all your water is bottled because of the dysentery. And then there's other protozoas like the tsetse fly that can cause sleeping sickness. And so there's many different protozoas, but all of these, like I said, they have one thing in common. They do have to have water to survive. All right. And this is showing you do you need to know this? No. If you go on to micro or nursing or become a doctor or whatever, you're going to need to know this. I loved micro, so this was all nerdy for me. And protozoas break down into multiple different classes. I personally like the amoebas and the paramecium, but you'll see that they group all of them into one because they all need water. And then next thing we're going to speak about is fungi. Okay? And yes, he's a fun guy, but the singular form is a fungus. But the study itself, when somebody who studies funguses, this would be the study of mycology. And say you became a doctor of mycology, you would be a mycologist. That means you specialize in fungus. And fungus, believe it or not, are one of the things that when a patient gets, it takes weeks upon months to rid the body. And sometimes we're never able to completely, depending on what's wrong with the patient and their underlying conditions, get rid of fungal infections. But the good news is most fungus are not pathogenic. Most of them they're chill. They live with our normal flora, they hang out, they're good to go. But here's where the big problem is. There are a certain few funguses that are pathogenic, that will cause the human issues. But here's where the real kicker comes in. Funguses in immunocompromised patients, funguses in people going through cancer treatment, small babies, infants, the real elderly, these can be deadly. And my dad actually had, we couldn't, they couldn't figure out what was wrong with him for the longest, and he had had multiple infections, and he had actually gotten he had been on so many antibiotics that his body was able to grow a fungus, and it formed around his liver, and so yeah, they were going to do a biopsy from that. They actually punctured his liver, and he bled to death. But so, yeah, fungus is nothing to mess around with. And when you have a patient who comes in who has that red flag, immunocompromised, could it be HIV? Could it be what, like I have, multiple sclerosis? Could it be rheumatoid arthritis? There's multiple autoimmune diseases, okay, that cause us to be immunocompromised. So if a patient has that, they are more susceptible to catching these things that usually wouldn't cause a healthy person to be ill. Uh, Now, let's just think about fungus infections in general. We have many different types of funguses as well. Now, one thing that everybody always finds so like, what is ringworm is not a worm. Ringworm, when you get a ringworm, it's a fungus. And a lot of people did not know that. And whenever I tell them that, they're like, I always, you have a cat or dog or something, and you got that little round, ready, raised infection. And, most of the time, your mom or your grandmother or whatever, it's, oh, you got worms from cat butt or whatever. Nope, you got a fungus. Um, there's actually a fungus that can affect the lungs, and it's pneumocystitis. It's a very serious fungal infection that affects in the lungs. Aspergillus is what we find in that black mold that they say, is highly toxic. And then there's other forms. And then there's yeast. Now, how many of y'all, now I know as most of us are ladies, at one point in time, we've had the unfortunate, probably when you were pregnant, because that's when it loves to get you, is you get a yeast infection. Or if you've been on antibiotics too long, you'll get a yeast infection and just be like, everything's itchy down there. It is not comfortable. And that's a fungus infection. And believe it or not, we don't realize, like I said, uh, how much of a discomfort and trouble that they can cause. This is why we see a lot of our patients with HIV and who are immunocompromised keep chronic yeast infections. It's not uncommon. Um, the I'm trying to think. This is what I wanted you to know. The yeast infection, when we think of it in the medical term, that's monolysis. And I think this is one of your SurveyMonkey questions. So a yeast infection medically is monolysis. Now let's think about that. What is the common over-the-counter treatment that you can go and buy when you get a yeast infection? Monostat. Oh, wow, right? Because it's a play off of the actual thing. So It's actually a highly, highly, highly concentrated. That's usually why they put it in like a little suppository, and that you got to like plop up in there. And it's because it's like a super dose of antifungal medicine. And usually, if you, especially if you get the 24-hour one, within the next 2 days, you're usually good to go. And that's fast acting because most fungal infections, if you get some on your feet from like, or jock itch or something like that, it's going to take weeks because the spray's just not as effective. The creams and stuff like that for topical, they do take much longer. There's another type of fungus that you should be familiar with. If you've ever had a baby and the doctor's like, oh, they got thrush, that's candidiasis. And that's thrush is when the babies or even sometimes adults will get a white coating on the top and the roof of their mouth and their tongue. And this, it's a fungal infection. And it's usually because the nipple bottle or breast, whatever, wasn't properly cleaned, or uh, I know, especially like in when I grew in Texas, um, when I had my son, it was, even though I boiled everything, I left it out to dry, and because there was still moisture, the fungus was he got a thrush once. So it's not something that's what do you call, uncommon, but fortunately there's medication for it and they're able to get rid of it. Um, Most of the time, if we have a mild case of a fungal infection, our body can fight that off. And we don't even know that it's doing it, right? But what I want you to remember, even though you done? Huh? Okay, baby. And then what we do know is that most fungus actually coexist with us and are beneficial. They are good for us and help part of our flora. Okay? We're going to keep zooming today. I know we're a little past. The next thing, see this little friendly guy? He says, hi. This is a parasite. And I like to think of a parasite as that when you have that one family member that says, I'm going to come and visit, and then they never leave. And then they just kind of mooch off of you for that's that's a parasite, because a parasite is something that has to have a host to live, because it gets all of its nutrients and everything from its host. All right. Now, one of the things that a lot of people don't know is that chlamydia is actually a parasite. So if you ever had chlamydia, you actually had a parasite. Um, Pinworms uh, are parasites. And when we start talking about them in the worm form, this is a word you might want to write down because nobody ever knows it. It's called a hemolith, and that means a parasitic worm. And they're usually not something that's readily seen. You have to actually kind of be looking for them. Examples of them are flatworms, roundworms, tapeworms, and pinworms. Now, saying that, this is where it gets fun. You get to actually, if you've ever had a kid who loves to play outside in like dirt, like, and build things and dump trucks and stuff like that, they probably picked up some pinworms. Brian was 3. Yeah, he's about 3 years old, and he comes and wakes me up in the middle of the night. And this is how smart this kid is. He's like, Mom. I was like, what? He's like, they're having a party in my butthole. I said, who are having a party in your butthole? He said, I don't know. It's wiggly like worms. And I was like, oh, heck. because he had pinworms. And that's usually how pinworms, let me go back. Pinworms are nocturnal. And you're going to learn later in how we check for pinworms is you turn off all the lights at night, you get a flashlight and look at the booty hole, and you'll normally see some little white wigglies. And another way that you can do it is get a piece of tape and actually at, like I said, at night, because they're nocturnal, and that's when they usually come out, and you can put the tape on the anus, pull it back, and then put it inside of like a baggie, and so the doctor can see it. But usually the doctor doesn't need to see them. You go in there, tell them, hey, you got the kid running around doing the booty dog scratch across the floor, constantly digging at their butt. They're going to know it's pinworms. It's not uncommon, because kids are always putting their hands and their fingers in their mouth. And if it's not cleaned properly and they've played in dirt or they've played in something, they're likely to pick it up. The next thing we're going to talk about, like I said, we're going to go a little bit longer, is insects. Insects can be anything that has, they fall into the arthropod, and they usually have 6 legs and a pair of wings. Okay? Insects can bite, they can burrow, they can attach, they can cause infections from like lice to Lyme disease to scabies. So humans can be fleas. Humans can be affected by insects. And this is actually where we're going to stop. So I finished my different things. Tomorrow, when we pick up, we're going to talk about how all the diagnosis and the testing. I'm going to post a few videos, some lab videos, and one of them is called the tape test, and then another one's going to be a stool sample for worms and showing you. But yes, you will have to possibly, especially if you work pediatric, have to deal with a stool sample every now and then, or geriatric, and so it's just part of the job. Just what my paramedic instructor said: "Suck it up, Buttercup," because it's gonna be something you deal with. But you eventually get used to it, I promise. But before we leave, did anybody have any questions on anything that we covered so far? Nope. Y'all nice and quiet today. Okay. Either y'all are in shock or it's grossed out or like, I'm had enough of this. But what I'm gonna do is, like I said, as soon as I get done with this, I have my staff meeting, and then I'm gonna post these videos and I'll post this lecture. When we hang up, please make sure that everybody hits the red leave. And the other thing is, if you haven't done your SurveyMonkey, get it in. And then also, if you are an on-campus lab student, you do not go to the campus early, okay? You have to show up at your designated time. Make sure you have a picture of the list that I told you that you're doing, right? You have specific lab skills that you should be learning per mod, okay? And always you have to have your scrubs, your stethoscope, your blood pressure kit, your lab jacket, pen, paper. I mean, come prepared. A lot of people are just walking, and a mask. A lot of people are just walking around like, oh, I didn't know I needed all that. Yes, you know you need all that. And then when you get your lab form, it needs to be something you take a picture of and send it to me once it's checked off. All right? Y'all have a wonderful day. And if you have any questions, you can always message me. Make sure you hang up.
Thank you.
Thank you. Bye, guys.